Many thanks, and thanks for that great New South Wales input. Firstly, I'd like to thank the organisers for giving us the opportunity to come and speak here today, and I'd like to acknowledge the traditional owners on where we stand and walk here today, and also to the elders past and present. My name's Patsi Mawn. I'm a Jewellery woman from southwest Queensland, from Roma, and that's on my mother's side. On my dad's side, Gungri, which is Mitchell, which is another hour west of Roma, and I was born on Manandangi land, which is where the town of Roma sits, and who I wholeheartedly pay my respect. Let's get Allan just to introduce himself first.
I'm Allan Takken. I was born in Winton, which is out near Longreach, which is Pita land. But that's on my great-grandfather's side. On my grandmother's side, I'm actually Kalkadoon, which is Mount Isa area. And I grew up here in Brisbane.
Cool. We're still Queensland. Okay, we can click it. Thanks. The statewide program the IROC program is a statewide program, and it's an initiative of the Queensland Statewide Respiratory Clinical Network. We're hosted and we sit at the Prince Charles Hospital, which is Metro North Health and Hospital and Health Service, Queensland Department of Health. The IROC program aims to, click. I need to say click, sorry. The aim of the, we're just, what do they call them? We're freaks for having control, aren't we? Okay. The IROC program provides a multidisciplinary specialist respiratory outreach service for and to improve respiratory health outcomes for Aboriginal and Torres Strait Islander people, both adults and paediatrics, within the rural, remote and urban locations in Queensland. We're here to enhance the local capacity for managing lung disease in identified sites in Queensland, and also provide a service that incorporates a combined medical and community development approach that embraces community engagement, cultural and holistic healthcare practices. The IROC service uses a stepwise process of community engagement, delivering respiratory health interventions to improve health outcomes by multidisciplinary teams in local communities, providing training to primary healthcare workers with respect to detection, intervention and treatment of lung diseases. Also building community capacity to self-manage chronic illness and promote health and wellbeing with the aim of community... Oh, he hasn't clicked it. Oh, sorry guys. You can hear me anyway, it's okay. Of chronic disease and health promotion. So we're up to the next one, which is IROC components. Cool. So the components for the IROC program is a specialist respiratory outreach clinic for adults and peds, as I mentioned, to urban, rural and remote communities. It's community engagement and education to promote culturally appropriate resource development, training, research and partnerships. So as you can see, this is just a bit of a flowchart on the partnerships that we partner with. But, we don't have time. We only have 20 minutes to have a yarn about our stuff today. So we're going to be just promoting our section the areas that we're doing work with Lung Foundation. Click. As at the 31st of December 2013, a total of 154 adults and paediatric clinics had been conducted, with a total of 1,335 patients being seen. There are 70 adult clinics and with a total of 572 patient visits, and 84 paediatric clinics where a total of 763 patients were visited. And we currently have 83 clinics booked for 2014. So we don't have much time to rest, and we travel out and about most of the time. So the respiratory clinics, click, I've got it up, sorry, missed that click. So the respiratory outreach clinics that we take out is they comprise of a respiratory physician, a respiratory nurse, a respiratory scientist, and one of us Indigenous project officers that are from the state, across the state. The paediatric team also travels with a paediatrician, a physiotherapist, sorry. Click. This is there's a picture of Queensland, and as you can see, the orange dots denote paediatrics, and the purple ones are for adults. We do have a bit of a space in Central West and also up in the Cape area, but we're hoping to work hard on getting clinics out that way, or there's some negotiations happening now to get some of those clinics up and running in those areas. And of course, when you travel, we use lots of modes of travel for travelling. On the left-hand side at the top there is, we followed a road train out of Rockhampton to go to Warrabinda, which is a 2-hour drive. And real foggy morning, and that's just one way to going. The other way is just a ferry in the middle there that would go from TI to, from Horn Island to Thursday Island. Charter plane takes the PED and the adult team to Mornington and Doomadgee. We drive cars to places like Cherbourg, which is only a 2-hour drive from Brisbane. We have the Dr. Anne Chang on the right-hand side there, walking with Rebecca Jackson, who's one of the respiratory nurses at Bamaga. And on the bottom right-hand side is the International Airport at Doomadgee. And that's what it is. Okay. So some of the outreach clinics, just on the top left-hand side, there's a young lad there up on Thursday Island who's getting his spirometry test done. And so he's pretty proud of the peg that sits on his nose. In the centre is Joe Wex, who was a respiratory nurse in Rockhampton, who does the Warrabinda clinic. And right-hand side is Rebecca Jackson, again at TI with a young lad. Down the bottom is Darren Smith, who's been located from the Prince Charles Hospital, and he's the respiratory scientist, and that's up in TI. And in the centre is Stephen Leong. He's one of our respiratory physicians, and he's based at the Prince Charles as well, and that was a Warrabinda. And down the bottom is just a mum who's just filling out some paperwork for her child to see to go through the clinic. So we do community events, and the benefits of the IROC program participating in the community events is that there's better awareness. We can share the awareness of respiratory health and healthier lifestyle choices. We can increase our own profile. Also gives us the opportunity to network with other service providers and opportunity to engage in discussions regarding potential partnerships with other service providers. Click. Resource development. Our table's outside there, so you can see some of our resources that we provide. There's we've got a little iPad on the table as well that show a lot of our multimedia media style stuff with little snippets and DVD stuff. So we try and do our resources so that it covers a whole range of age groups, I suppose, and also, as we talked about, literacy and what people can understand and what they can easily read. So there's a suite of culturally appropriate respiratory health education resources which have been developed for Aboriginal Torres Strait Islander people and health workers. And Allan will go into the ones that are relevant to this session today. So, lung health. I'll hand over to Allan. He's going to take over again.
Thanks, Arnie. So in 2010, the statewide Respiratory Clinical Network conducted an Indigenous lung health mapping and needs analysis study in Queensland. From this, they produced a report, which was the Lung Health Service for Aboriginal and Torres Strait Islander People in Queensland report. We actually have a copy of that down at our stall if anyone wants to come and have a read. Unfortunately, we don't have any to give out. And then from that report, lung cancer was identified as an area that needed to be looked at. Next slide. So just some stats in Queensland. Lung cancer is the leading cause of death. Lung cancer incidence and mortality rates are higher in Indigenous Australians and increase with remoteness of the residents, as we would have heard earlier through the stats that were mentioned. There were 228 reported cases of lung cancer in Indigenous Queenslanders in the period of 2007 to 2011. Next slide. Indigenous Australians have longer than average length of stay and are hospitalised at a higher rate for lung cancer related care. The rate of hospitalisation and patient days for lung cancer related care is noted to increase with remoteness of the resident. Next slide. Yep. Indigenous cancer patients are less likely to have the range of treatment for cancer. They wait longer for surgery and have more comorbidities and poor survival than non-Indigenous patients. The extent of problem of lung cancer in rural and remote Aboriginal and Torres Strait Islander communities of Queensland is still unclear. So IROC has done some research around this, obviously in lung cancer, and that was sort of lung cancer in Indigenous communities in rural and remote Queensland research project. This was headed by Barbara Page. Are you here, Barb? Nope, okay, sorry about that. So for this, we partnered up with Lung Foundation Australia, Checkup and Cancer Australia, to complete this one. From this project, we completed a lit review, a mapping and needs analysis. There's a report on those as well that was produced, done by Barb Page. The community consultation report as well. Patsi and Barb done that one together. And then the lung cancer resource development. We've developed a lung cancer patient education flip chart, which we have outside, and in the middle, or pretty much finalising our lung cancer orientation manual for Indigenous health workers. And those resources were developed by myself with the support of the IROC team and partners. Next slide. For this, we had some artwork developed by a Aboriginal student by the name of Jordana Angus. The interpretation of the artwork is very colourful, but it also sort of shows the effects that things can have on your lungs and the way that you deal with it, plus the way that they infect and the cancer cells continue to affect the rest of the body. So some activities around lung cancer which we're still doing. We've got the lung cancer DVD. This takes in the whole journey. As we heard earlier yesterday from Archie and I can't remember the other auntie's name, I'm sorry, but how they spoke about the whole approach, not just going to your appointments, but the effect it has on your family. The whole mind, body, soul approach. So we believe that there's not too much going on in this area, that approach, so we're pretty sure this could be an Australian first, and very, very valuable for not only our people, but for health professionals as well. Some other resources we've got. So we've got the talking boards. As we know, literacy levels and even English isn't the first language of a lot of people that we see. So we've come up with these talking boards which gives you a spoken message as well as your written message on the front. But we've also had these boards developed in Creole, and I know that there's a few different dialects of Creole, but this is sort of mainly aimed at the Thursday Island area because that's the way we service. We've also developed some posters. Just want to point out the two, the one in the middle and the one on your right. The artwork there was done by a health worker in Mount Isa by the name of Isaiah Milne. He's very, very passionate about Indigenous health, and a lot of the artwork that he does is based around the health of our people. The poem, I sort of done up like a little hip-hop rap sort of poem thing for the kids to sort of relate a bit to and sort of rhyme, and something that's catchy to stick inside your head. And then the one on the right, that was developed by a young boy from the out west district, and he basically a message to kids and to the adults to stop smoking. It's not cool, it's affecting me as much as it's affecting you. Yep. We've also produced 7 short video clips. 6 of those have taken a sort of a funny sort of taking the mickey approach of things that can happen through smoking, and just trying to get that funny message or that message to stick with the people. We've also done a R&B hip hop clip, which was a further step from the Deadly Non-Smoker one I spoke about earlier with Isaiah. And that was produced by some kids, a group of kids that wrote the song pretty much off the poem that I'd done up. the music was developed as well for this specially, and the video clip, the kids just went mental and had a great time. And the parents actually took the message in and have tried to sort of cut back on the smoking and do the right thing by the kids. So yeah. So here are the 6 video clips. You can find them on YouTube. They're pretty funny. Just, I think if you search sort of IROC smoking cessation, something like that, they'll pop up. Yes, sorry, I forgot about that Lung Foundation website, and they're also on the Statewide Respiratory Clinical Network, Queensland website. We've also done 2 radio jingles, which are, again, just trying to get that funny message out, but, you know, obviously the serious side of things. And then we've also in the middle of developing a smoking cessation tool for follow-up for health workers, obviously to work with their patients. So the future, at the moment, we don't have anything going forward in lung cancer, but we're very happy to talk and explore different partnerships and networks, and obviously even be involved anywhere we can, so around respiratory health. These are our contact details for those that are interested, and as Billy Moore would say, go Queensland.